going on, guys? We're live. We're live. I'm gonna just let people know now that holy shit, we're fucking live. Just letting people know. What's going on, Abdul Aram? Guys, give video a like as you're coming through. Give video a like, guys. Give video a like as you're coming in. Give the live stream a like. Give video live stream a like. Abdul Rahman, you're first. Abdul Rahman, you're first. Mahmood. What's going on? What's going on, Mahmood? What's up, Mahmood? What are you doing? Joy, good to see you. Greetings. We're already off to the fucking races. Paria is like hardcore, straight up, like no intro. We're just like straight up into it. Let's have a double question mark, fucking like that's it. Fresh out of the gates, right? No warm up. Abdulram, how's life? Ikwahaja Noor. What's going on? Good to see you. Jamila. Jamila, are you new? I don't think I've seen you in my live stream before, Jamila. Paria. I've seen you, Paria. That your name looks familiar. Yeah, Ray Molina. Yeah. You look familiar. Hey, Doc, I wanted to ask about the forms you were talking about for STEP. Are there only forms due for Step 2, not Step 1? The CMS forms, yes, they're Step 2. The subject-specific forms, they're Step 2. Shabib, your legend, sir. Ayad, what's going on, Shabib? What are you up to right now? What's going on? I'm just going to let other people know that we started this. Let's see. Just letting some other people know. Guys, give video a like because you're coming to live stream. Holy shit, give video a like. Steel Titan, good to see you again. Are you sure you're not you know what, Steel Titan? You know what you should change your username to? You should change your username to Carbon Fiber Steel Titan. Or no, not Carbon Fiber Titanium Titan. That's who you should like. Carbon Fiber -TI Titan. That's what you should change your username to. Right? Yeah, I feel like that would get like more traction. Right? Carbon Fiber -TI Titan. That would get more traction. Tushar, watching Mission Impossible. The best scene of Mission Impossible is the final one with the helicopter, where he folds the red and the green gum. He's like, red light, green light. Like that's like the most like classic fucking epic Tom Cruise ever. Because it's so ridiculous. It's like so over the top ridiculous. It's so ridiculous. But it's like it's just like that scene encapsulates like classic Tom Cruise in a nutshell. Yeah, I think that's just like it's a good fucking movie. It's an old one. Saad Barkat. Hey, Dr. Mike, I passed Step 1, did your neuroanatomy, risk factors, PDFs, arrows. Thank you for your efforts. You are gold. Thanks, Saad. Happy to hear you passed. Hello, tomorrow. Good to see you again. Guys, give the live stream a like coming in. Hello, tomorrow. Hello, Doc. Did my last practice for 120 at 75%. That's good. What do you think? Yeah, I think that's good. HUD. Yeah, that's right. You're last. You're not last, but you're further down. That's right, HUD. Paria. So many queues come in so fast. I wanted to get mine in. Well, that's smart. That was smart. Mahmoud Ahmed. Doing well. How are you? Inspire. Dawit. Lamecha. How can we guarantee a pass in Step 1 in 1 month? There's no guarantees in life, but you're going to go through NBMEs 20 through 24, free 120, then 25 through 31. You have to memorize those forms, those exams. If you are going into the Step 1, you're not doing that material, you're stupid. Hey, nice shirt. Dude, I fucking love Blink-182. Like I grew up with that shit. I drove to school, high school, like blaring Blink 182. I got some I'm waiting on some Blink 182 fucking like some earrings actually. Blink 182 earrings. Some guitar pick earrings that are Blink 182. I'm pumped on those. Let's see. Gene Paul, how you doing? What's going on, Gene Paul? Good to see you. What are you up to, man? Jamila, you have Dr. I changed my username from Brima Jamila to that smiley face. Got it. Brima, yeah, I feel like Brima I recognize. Bruce Wayne, good to see you back. Are your resources plus NBMEs enough to pass step one, in parentheses, no UWorld? I am done 70% in UWorld and I'm thinking about stopping to do your PDFs and audio QBank, then NBMEs. Thanks for your work. I don't recommend people stop QBank. Like I'd prefer people finish all of QBank. I've said that. It depends on like the person, right? Like obviously if your scores are innately high, like if you're just a high scorer, there are going to be data points where someone's like, I did like, 20% of UWorld. Holy shit, that's it. And then I just did some NBMEs and I passed. Like I think for most people, I want to see you guys getting through all of QBank. That's what I prefer. If it's a situation where you don't have time and you have to move your exam up and you're not able to finish all of UWorld, it just means you got to get through the NBME exams for sure. I'm flattered if you want to focus on my PDFs, but just remember in the final month, you really have to consolidate around the NBME exams. And if you only have time for one of my PDFs, it needs to be high yield arrows. Div, what's going on? Oh yeah, Div. Let me adjust my light settings for you. Let me see. There, I'm gonna make it more purple. See that? There, it's like hardcore purple now. Jamila, always active, especially with your videos. Yusef, how you doing, G? What's going on, Yusef? What are you up to, man? Khaled El Manawi, what's going on, dude? Good to see you back. How to know which cues in your QBank are for step two? Well, when you go into the QBank, you'll see that each question has. Actually, no, doesn't. I don't say that. I think it's mainly at the start of the clip. I mean, I'll tell you. I'll say it's like paths or renal step one, path step one, and like that's it. Or I'll say like this is for renal step one, internal medicine 2CK. So it's like a fusion clip. Like so. I don't label things step one, step two individually, as you might imply that you want to see, because that kills analytics. People are assholes. That's why. Ayad Ali, hey Mike, are chemotherapeutic drugs high yield? Yes, they are. I see QBanks ask about them. They are high yield chemotherapeutic agents. The highest yield ones are like cyclosporin, the calcineurin ones, right? Cyclosporin, tacrolimus, sirolimus, not calcineurin, but those, those T cell drugs they like. The other drugs, like there are drugs that are not as high yield, right? Like azathioprine, mycophenolate mofetil, 6-mercaptopurine, 5-fluorouracil. Those drugs are not as high yield. Hydroxyurea is high yield, but it's not really used for like chemotherapy. It's used for increasing HbF and sickle cell. It can also decrease polycythemia vera, hyperviscosity syndrome crises, but for hyperviscosity syndrome, they just want phlebotomy as the answer for that, actually, in Usmle. There's a lot we could talk about, but yeah, you need to know various. Rituximab, very high yield, right? CD20 on B cells. And the answer on the NBME is bacterial pneumonia for that. Meaning they say, what are you at increased risk for if you're on rituximab? The answer is bacterial pneumonia. Students are like bemused, nonplussed, flummoxed regarding that question. And it's not really a big deal. It's like, well, what do B cells do? They mature into plasma cells, which secrete immunoglobulins, humoral immunity. So if you knock that out, you're increasing risk for bacterial pneumonia. Paria Remolina. How do you know any IMGs in GS residency? I haven't graduated yet, but I really am interested if you have any thoughts. Are you talking about Gen Surge? I don't need acronyms. I'm assuming you're talking about Gen Surge. People in medicine are like very pompous about like acronyms. It's like if you don't instantaneously know like someone's acronyms that they're using, they're like, really? You don't know my acronyms? But like GS, I had to think about that. Like, how often do people say GS for Gen Surge? I mean, people match in a Gen Surge, yes. It's like one rung on the ladder more difficult to match into than like FM, IM, PEDS, OBSCYN, probably. Psych. But I don't know why anyone would want to do surgery. It's boring as fuck, but you need surgeons in the world, right? Vakya Revenue is NVMe 8 for 2CK reasonably predictive. It is. People say it's really easy. Well, people don't know what the fuck they're talking about because all of the NVMEs are the same. Okay. And I say this, it's like objective that it's the case. And then also, subjectively / anecdotally, it's my observations over the years. Like when I was studying for 2CK back in the day, NVMe's 4, 6, and 7 were online. Okay, there was no NVMe 5, but 4, 6, and 7. Everyone said, "Holy shit, that 7 was like the hard one," and 4 and 6 were easy. That's what people used to say back in the day. Okay, I got shitty scores on 4 and 6, and then I was like freaking the fuck out because I was like, "Well, 7's supposed to be the hard one," and then I went up on 7. I did like really well on 7, the supposed hard one. So, I mean, this is escapism that people engage in on the forums. People don't know jack fucking shit. It's just like people like to speculate. As I said, it's part of stress relief / escapism. All the forms are the same. Dawit Lamecha, you are a God. Thanks, Dawit. I don't know if you're my friend from outside med because you asked a med question before, but I literally have like another friend named Dawit. It's not the most common name, but I have another friend named Dawit outside of med. Who like knows I do these live streams as well. Ahmed Hendy. Hi, Dr. Mike. What's going on? HUD, do you skip leg day? No, I actually did leg day today, technically, because it's 4:39 a.m. Saturday here in Japan. I went to the gym yesterday after I did my previous live stream, which was like 6 a.m., 6:30 a.m. So 22 hours ago, 22 hours ago, I was doing leg day, right? No, I don't skip leg day. I mean, what am I going to do? Is the purpose of this live stream talking about my legs? Is that like what we want to do? Is that your interest right now? Is that what we're asking? But no, I don't skip leg day. I did yesterday, or I guess today, right? 22 hours ago. I did legs. I did abs. I did very, very little arms yesterday because I needed rest on them. But I'll do upper body today if you're interested. Ahmed, hey doc. Ahmed Hendy, congratulations completing 800 Qs tomorrow. Well, maybe I won't put out a Q tomorrow. We don't know yet, Ahmed Hendy. But you're right. I'm almost at 800. 799 was the MCQ I put out today. The MCQ I put out today didn't get many likes, actually. Didn't get many likes. I observed that. Let me see right now. It's so it's been out for 4 hours. It has 22 likes. That's it. 334 views. That's not terrible for 4 hours. That's not bad. That doesn't strike me as necessarily low, but 22 likes for 334 is bad. It usually is 1/10. It starts off that way. My general subjectivity is if I were to see 334 views like I am right now, I expect to see in the 30s for likes, or 444 views. I would expect to see 40 likes or something. That's how it tends to start off. And then a lot of you guys are assholes where some of you will watch the clip to save it in your playlist, and then you unlike the fucking clip after because you just use it as you're saving it, as I said. So I noticed there will be a spike of likes, and then it goes down, and then it goes back up. That's what tends to happen with likes. But I consider this a poor performing video, and I think it's probably because it's too easy for some of you. Some of you are oh, it's Goodpasture syndrome. That's easy. He's talked about that. I don't like that. Well, it has to be high yield, right? It's high yield. I mean, it's a fucking excellent clip. I don't know what people are crying about. It's I'm not going to like his clip. I don't like that. Don't like my shit. It's all right. You don't have to like it. Like this clip though. Like the live stream. Ahmed Hendy. I just read that. Abcom 98. What's your favorite Blink 182 song? Roller Coaster. I like Roller Coaster. That's like, I used to blast that shit. Um, yeah, senior year of high school. That's like that. I mean, it's like everyone's got like their own bands that are like nostalgic in different ways. Whether you went to shows, I've never been to a Blink show, but like that was a Blink 182 was like what I listened to probably like the most when I was in high school. Um, Ikwa Nur. I wanted to ask that as I mentioned yesterday, I'm an old grad, so should I just read the QBank in capitals, no annotations or memorizing? That's what I said. I've said just read QBank. Sagar Patel, hey Mike, what's going on? Adila, thanks for being a member. I appreciate it. I know you're a member because you're green and everyone else is gray, and you got my icon next to you. Hello, Dr. Mike. I saw a question where a patient had celiac disease but negative IgA, anti-tissue contaminase, and antibody screening. Could you please explain? Well, I believe it's a 15 times greater risk of having, like autoimmune conditions go together, right? There's no strict HLA associations you have to memorize. Like HLA B27, that's one thing. But when you talk about like HLA DR3, DR5, Usmle doesn't give a fuck. So it's pretty much something like patients who have celiac disease, there's like a 15 times greater risk of having IgA deficiency compared to like the general population, which makes sense if they go together. So aren't you going to have anti-tissue transglutaminase IgA? And if you had concurrent IgA deficiency, you could get a false negative, right? So that's like one thing that's possible, potentiality. Abdul Rahman Mohammed, are Mehlman PDFs specific for step one? I mean, no. Like there's some are like biochemistry or right immunology. Those are like step one, and likewise I have step two PDFs like surgery, pediatrics, right? But I mean the general systems PDFs like cardio, pulm, renal, gastro, they're both steps. Shivi Dua, do you have any test taking strategies for MCAT? I don't. I stay within my lane. That's the thing. I don't pontificate about things that I'm not conversant on. So I mean that's um, in general though for MCAT, I would say just do lots and lots of questions. When I prepped for MCAT back in the day, and you're talking like I don't even fucking remember. It was like 2007, 2008 ballpark. I just read a Princeton review book, I think, for like a week and a half or something, maybe a week. And I did some like practice tests. And I think I only prepped for like 2 weeks. And I talked about this in a previous live stream because someone asked about MCAT. And I was saying my degree in Boston my undergrad prepped me really, really well for the sciences. So I felt like I didn't have to study for it. But I would just do lots of questions, do practice tests, and just go through like a Princeton review book or something. U-turn, high doc, NBME, 25, 60%, it's a fail. 26, 57%, it's a fail. 31, 64%, borderline, maybe close to a fail. 27, 63, I think that might be a fail or very close to it. Exam in 3 weeks, should I proceed? No, you're not going to proceed. Now, here's the deal is that occasionally people can't move their exam. You're asking, should you proceed? So clearly you're capable of moving your exam. If I have students who literally can't postpone, many of you can't, you just have to continue with the NBME exams in the final weeks, irrespective of your scores. But I don't like people YOLOing if it's not necessary. So I would prefer to see you stop all NBMEs right now, and you're going to spend an entire month doing QBank and corrects 40 per day. And then you're going to do my PDFs, my YouTube MCQs as the second phase of your day. 40 questions, untimed tutor random, just the incorrects. Second phase of the day after lunch, PDFs, YouTube MCQ playlist. You're going to go through all that for an entire month into mid-August. And then you're going to go back to the NBME exams. You're going to redo 25, 26, 27, 31, all the exams you've already done. We don't care about your scores because clearly you've sat them. Maybe you'll get 85% correct. Okay. I mean, okay, cool. But they'll function as review. Then you're going to do 20 through 24, and you're going to do 20 through 24 free 120, then 28 through 30 in your case. You'll be fine to sit by, probably the early September, I would say. That's what I would do. Ahmed, sorry for this. Sorry for this Reddit question, but I saw someone say that on Reddit that their exam was nothing like the MU's. I mean, I don't really know what to tell you. Okay, what do you want me to fucking say? That's how people will be. It doesn't mean it's true. I've harped on the fact that like when you do the real Usmle, it's going to look like UWorld. Okay, so it's going to be the same colors, calculator, lab values, but the questions will be like an NBME 32 and half of an NBME 33. That's what it's going to be when you go in there. So the questions are the same as the NBMEs, but it's going to look like UWorld. It'll look like the free 120. Okay, so you're going to have these anecdotes as far in people's experiences, unique experiences, and they say it was nothing like. It was just like NBME 29. Oh my God, guys. And then that perpetuates like people saying like the exam's like 29. And then I get dumb DMs about like, Mike, someone said on Reddit, it was like NBME. I mean, so that's what, I don't really care about that. Objectively, just the NBMEs are the USMLE. Paria Romolina, what would you say we should do the last 3 to 4 months we finish UWorld? If you finish UWorld, you should only be doing 1 more month of prep for USMLE. You shouldn't be doing more UWorld at this point. So you're just going to see how you go on the NBME exams. And if your scores are 205, 210 plus, you can just sit. Should be, what's the best way to do USMLE RX? Timed or tutor mode? Why are you doing USMLE RX? If you're like way far out from your exam, if you're in like first year med, second year med, you're far out. And if that's why you're asking about USMLE RX, you could do tutor untimed random. I don't like time mode for Q-banks. Tushar, thanks Mike for the spoiler. Well, it was an easy question. And even if I gave it away to you, my YouTube MCQ, the answer, as you're saying, it doesn't necessarily. I gave you the diagnosis, but it doesn't necessarily give away the answer. U-turn, when you travel in August, will you continue doing YouTube lives? I can't commit to that. Maybe. I mean, maybe. I don't know yet. Div, I was just about to ask you to change the light. Thank you. Well, yeah, you're right. I changed it to purple for you. Brighter purple. Sham, hey Mike, if I read UWorld throughout the entire year last year while I was prepping for school exams, what would you have me do? Would you have me reading it again, or what should I do for prep for step 1? I'd want to know how far you are out from your exam for step 1 at the moment. And you could do UWorld incorrects or just do like AMBOSS at this point before doing the NBMAs. Greg, hey Mike, I found your vids helpful, very helpful for step 2. Keep up the great content. Thanks for the medical content. Thanks, Greg. Okay. Hayat Ahmed. Let's see, lost it. Hayat Ahmed, hey Mike, wanted to really learn ECGs from my own understanding. I don't know that. I would just do my cardio PDF for ECGs. They're like, my new cardio PDF is loaded with ECGs and all the murmur stuff you need to know. Com98, if I plan on doing the CBSC August 2024, when is the optimum time to start preparing, given that I need a good score, maybe in the 80s? You're fucking over a year out, bro. Just do like a shitload of QBank until then, and you're like, that's all you're going to do. Just lots of questions, go through the PDFs, finish my YouTube MCQs. You're so far out. U-turn. Should I marry after or during residency, considering I'll start when I'm 26 and finish when I'm 32, 33? I mean, it depends. I don't know if you're a boy or a girl, a guy, gal, I don't know. If you're a dude, I wouldn't recommend getting married at 26. That'll trigger some people. If you're a chick, that could be a good idea, because I think it's a good idea to make kids when you're younger. That'll also trigger some people. I think, yeah, that's what I think. I think if you're a dude, not until at least your mid-30s, really, you shouldn't think about something like that. But if you're a chick, I think you should get married earlier and start having kids earlier. I think it's a bad fucking idea to put career ahead of kids as a female. As I said, I'm not saying what should be done. I'm saying what, we're talking opinions here, right? I don't think it's a bad idea for women to have kids when they're younger and actually build families, and so we don't have population collapse. Let's see. Rock RAAGHVI. Hello, sir. What is the treatment management of ischemic stroke due to atherosclerotic disease versus emboli due to AFib? Well, the whole thing about you're going to do non-contrast CT, right? They like that. So that's going to look for bleeding. And of course, you're going to do TPA if it's within 4.5 hours. And they ask what you do after 4.5 hours. Holy shit. That's like an interesting one, right? People are like, oh, actually, I never thought about that. What do we do if it's after 4.5 hours? NBME exam, a TCK, they just want aspirin as the answer for that. I've seen that. Zane, hello, just scored 56%. But when we talk about embolic phenomena, Usmle will go down a whole rabbit hole / algorithm. I've talked about this many times as far as carotid stenosis with an atheromata launching off versus atrial fibrillation with a mural thrombus launching off, and how to investigate for those. Someone just became a member. Manas Weenie Keshav, thanks for becoming a bronze member. I really appreciate it. Appreciate it. Div, are you able to see those floating emojis? I do not see any floating emojis. Actually, maybe. I see the hundreds. I do, but I don't I can see them with my rods, my peripheral. I'm not looking at them centrally with my cones. Bruce Wayne, my exam is in 2 months. I finished high yield cardio today, and I feel that your PDFs will help me do better in the NBMEs, in parentheses, more than UWorld. But if I continue UWorld, I won't have enough time for the PDFs. I want you to do this, just do them at the same time. I've said that. People vastly underestimate how much time is needed for my PDFs. You need to go through my PDFs while you're going through QBank, kind of from the start, so that you can finish the PDFs by the time you get to your dedicated where you're focused on the NBMEs. Guys, give the video a like, coming to the live stream here. Subscribe to my channel if you haven't already. P. Kumar. Speaking of subs, something really weird happened on my YouTube about a day ago, where it was maybe I don't know, 12 hours ago, where I checked my subs and it dropped by 50 instantly. And I'm like, what the fuck? And I thought something happened. I'm like, did I do something wrong? What the fuck happened? It dropped by 50. And then today I was checking it, it jumped up by 50, instantaneously. So it was some fucking YouTube glitch. But I literally had 12 hours. I'm like, what did I do? Did I offend people? What happened? I literally thought 50 people unsubbed to my channel because it dropped by 50, and then it spiked instantaneously within 2 seconds up by 50 today. And I'm like, okay, I guess it was just a fucking dumbass YouTube glitch. P. Kumar. Got semester next week, prepping up for physiology. Couldn't find much of physio. High yield arrows. That's physiology. But loved your anatomy biochem content on the website. High yield arrows is physio, right? High yield arrows is all physio. So do that. Tushar, you look absolutely fresh for 4 a.m. It's 4:55 a.m. Did you wake up just now or haven't gone? Well, I had 4 hours of teaching and 2 energy drinks to get through students that I had until I finished at, it would have been 3:20 a.m. or something my time. And then I took a nap for 20 minutes. I'd set my alarm for 4 a.m., but I woke up before my alarm. And this was similar to yesterday. I was saying the same thing. I had fucking crazy ass fucking dreams. I was twitching with real deep, hardcore REM sleep as well. Like twitching. And then I woke up refreshed. But I was just lying there. I couldn't get up. But then I got up for this live stream. Well, I had a matcha. That's what I had. I posted the pic to the IG story. Right? I posted my matcha pic not today but yesterday to my threads. Holy shit. It got 3 likes. That's a good reinforcement to use the app, right? It's you post something, it gets 1 like, 3 likes. I'm all right, no one gives a fuck about my matcha on threads. Don't like my matcha on threads, no problem. Miriam, do you know any student who passed step on their 4th attempt? I mean, I know people who've had many attempts at it. I think they only allow 4 attempts now. But yes, I mean, there's going to be people who, it takes them many tries. It's like comp, right? There's people who take comp CBSE for their school, like, 4 to 7 times, literally. And so it's no different from step 1. I mean, occasionally someone passes on the 4th attempt, their comp CBSE, right? And same step 1 is same as comp if NBME sponsored school. I say that because AUA, SGU, AUC, they don't have NBME proctored exams anymore. Ayad Ali, let us meet you when you visit New York City. Okay, I mean, I'll be in New York in August. I'm not going to meet some random. Like, I'm not going to be like, no idea who the fuck you are, and then I'm just going to meet you on the street somewhere. Like, I'm not going to do that, necessarily. No, I'm not. Right? And I'd be less inclined to meet up with some random dude as well. I don't know what to tell you. Paria Remolina. I've had that happen though. Like I had some random fucking person who wasn't even following my IG, some random dude who like came to Osaka and like wanted to meet. And I was like, bro, you're not even following my IG. Like, get the fuck out of here. Like, I didn't say that, but I'm thinking that. I'm like, why would I meet some random fucking dude who like comes to Osaka? I'm like, no interest in seeing some random dude. And you're not even following my account. That's like very sus, right? Like, I don't know who the fuck you are. Paria Remolina. Am I the only one who liked? There is one like. I see 43 likes. I see 43 likes. So if you only see one like, I mean, that's unfortunate, right? I see 43 likes. Dawit, LaMecha, Pink Floyd, love this band. Abcom98. Guys, increase the likes, though. Increase the likes. Let's get over 50. I only see 43. Abcom98. The best way to get higher engagement and grow the channel is to be a polarizing figure. You're talking about your likes in the videos when I typed this. Yeah, I guess. I mean, I don't try to be anyone other than me, right? Like, I don't really know what to tell you. I think I'm already like slightly polarizing for the medical domain, right? Like, if it's not medicine, like, I'm not polarizing. But I think for medicine, like, that becomes polarizing because like people expect some like, Indian with a dress shirt on, wearing a stethoscope, holding up FA or something. Like, that's how there's two main type of influencers. You're either like some Indian or Pakistani holding up FA with your stethoscope, or you're like some, 22-year-old female dancing with like FA or something with like your coffee mug. And then you get like 279,000 views, right? That's like, those are like the two main, and then you got like, other randoms like me that grow slowly. I'm doing things the hard way. I'm doing things the real way, putting out videos every fucking day, and I'll do it for years. We'll see what happens. HUD, amiloride, trampoline are used for Little syndrome. I don't give a fuck about Little syndrome, dude. But you didn't mention it in your renal. Little syndrome, there's a reason why I don't mention dumb shit. It's because the yieldness is through the floor. It's not about mentioning random stuff for entertainment purposes. Like, any of you guys in this chat right now, any of you guys seen an NBME question on Little syndrome? Not QBank bullshit. I'm talking about NBME questions. Any of you guys seen an NBME question on Little syndrome? Exactly. No fucking existence of that question. So, but I'll tell you, if you want to know the high points about amiloride trampoline, I'll tell you. Well, not only are they ENaC inhibitors and potassium sparing, but they are the answer if a patient is already on a loop or a thiazide and needs another diuretic. So the first diuretic you're going to use for fluid unloading is furosemide, classically. Furosemide is not used for blood pressure. It's used for fluid unloading, pulmonary edema, peripheral edema, okay? So you fluid unload a patient with furosemide, and then the vignette's going to tell you a patient is already on furosemide, holy shit, and we need to add a second diuretic. So what are we going to add now? And the answer is you're going to add the potassium sparing diuretic because we don't want hypokalemia, right? So loops can cause hypokalemia, thiazides cause hypokalemia. So you don't want to add a thiazide if the patient's already on a loop, you get hypokalemia. So you add potassium sparing diuretic. So they can just have amiloride as the answer. They can just have trampoline as the answer. They can have spironolactone as the answer. Okay. The Eplerenone, I don't think I've really seen it assessed. It's more just like you could be aware of it, right? 9 times less chance of gynecomastia compared to spironolactone, antiandrogenic, but like it's mainly just a millerite, triamterene, spironolactone. Those are the high yield potassium sparing diuretics. That's what they ask on Usmle. They don't give a fuck about bullshit little syndrome. I don't think I've ever seen that assessed. ABCOM 98. You already have controversial views on polarizing issues. Maybe you can lean into that. Well, I mean, I'll lean into certain things, but there's also like, people are it's off the rails with cancel culture nowadays, right? You say one thing that like offends somebody, and then so I don't trust free speech. I don't think there's free speech. I don't think we have free speech. So I'll talk around a lot of issues. I'll attempt to, I'll euphemize a lot of like views, and try to pamper people from being offended and salty and upset. That's how you have to talk nowadays. Abcom, Reddit, Manas, Weenie, Keshav, hey Mike, always make sure to like your content. Thank you. You're asking about CMS forms, compressive versus demyelinating spinal cord lesions. I don't know what the question is that you're actually getting at. Nothing really like specifically rings a bell. I mean, Brown-Séquard syndrome is high yield in terms of viral infection and SLE. So transverse. So when you think of Brown-Séquard syndrome, it's not just a stab wound. Okay, it's usually viral or transverse myelitis. So transverse myelitis due to viral infection or SLE. That's high yield for Brown-Séquard syndrome. Compressive, I mean, epidural abscess, metastases, right? Epidural spinal cord compression for METs. That's high yield. Giovanni, good to see you again. You put your last name back. You got rid of it last time. Hey, Mike, just passing by to say hi. Your PDFs are amazing. Thanks, Giovanni. Mo Sadiq, want to thank you for your efforts past. That's good news, Mo Sadiq. Doctor, I'm IMG old grad. How much score I need in 2CK? For matched internal medicine, just pass. 214 plus, that's all you need to pass. HED, why didn't you discuss renal physiology in your renal PDF? I mean, I discussed what's important. So what do you want me to discuss, really? Like, what do you want me to discuss? Like, do you want me to be like, this is the PCT, it does this? I mean, I integrate it. Like I may mention Fanconi syndrome, right? Where it's like the PCT, can't reabsorb bicarb, phosphate, amino acids, glucose, all down arrow for reabsorption. That's a question on one of the forums, right? I mean, it's not nonsense. It's hard to appease everybody. You want some people who want like, you have some people who want like a 300-page fucking textbook for each subject. Like, this is what the kidney looks like. These are all the blood vessels going to the kidney. This is the function of like, the PCT. And like, the same way some people in biochemistry, it's like they want like, this is a cell, like this is a mitochondrion, like you got to have a background of like, it's assumed that coming into the review resources that like, you have some sort of foundation already. So I kind of meet people in the middle. It's like they're review resources. Remember that. So I'm hand holding people to an extent, but I'm not like, I don't need to be like stage 0 about absolutely everything. Lazy Penguin Sing. My exam is in 2 months. I haven't done UWorld or NBME. What can I do? I think I will fail. What should I do? Well, why the fuck would your exam be in 2 months if you haven't done UWorld or NBME? It's like you haven't prepped. It's like me saying I have in law school. Like I have my bar exam in 2 months. I haven't done any practice exams, and I haven't done like UWorld for law school yet. It's like, okay, well, that's like mandatory. Manas, Weenie, Keshav. Someone has low blood pressure. 70/40. Do we give cross-match blood or RH negative blood? Well, you would give cross-match. I mean, you would get, if you know their blood type, you would just give that. That sounds like an AMBOSS question or something. That sounds like an AMBOSS question that they would play like gotcha or something. I haven't seen Usmle care. Lazy Penguin, any advice will do. Manaswini Keshav, as in, can we wait to give cross-match blood? Pure Aura, can I start my prep with PDFs? I've said you can. I just lost where I fucking was. Chat moved on me. Sometimes when you guys post, it just moves the chat on me. Can I start with with the PDFs? I said yeah, but like you're gonna do them alongside QBank. Like I don't want you. Turn off this fucking AC. Like I don't want you doing like pre-reading, quote unquote, and then doing like QBank after. I want you doing QBank and the PDF simultaneously, right? That's what I want you doing. Yash 244 and BME 29. Mariam Paso, hi. Good to see you, Mariam. Thanks for becoming a member. I think you became a member like yesterday. I saw that. Thanks. Paria. I finished my QBank in August, but I'm scoring around 50%. 40 mixed, so I don't know if I should start the bank over again because I tested in December. Well, what you're going to do actually, Paria, is you're going to finish QBank and then you're just going to sit NBMEs 20 and 21. And if you can score well on those NBMEs, then you're just going to progress through 22 to 24, free 120, 25 through 31, and sit. You can move up your test. If you do shitty, if you fail 20 and 21, then you're going to go back to QBank and corrects. If you're scoring around 50%, and you're finishing in August, I assume you're going to fail 20 and 21. So, but I'll still be optimistic about things. You can sit 20 and 21, and you're going to get 3-digit score equivalents. If you get a 189 or lower, you're going to go back to Q on either of those forms. You're going to go back to QBank for a whole month and do my PDFs and YouTube MCQs. If you can score 190 or higher on both of those, you can progress to maybe 22. But once you get to 22, I want a 197 or greater. If you fail any exam, 197 is internal pass mark for 2CK or for step 1. If you fail any exam, 196 or lower after NBME 22, then as I said, go back to QBank. But from 27, 28 NBMEs onward, I want to see 205, 210 plus. I want a buffer. I don't want you YOLOing where you're going to get like a 198 on NBME and then go into the exam and you're cutting it close. To my Jape, I am in second year med. Please guide on how to start prep, how to lay a good foundation, how to build up further. I mean, what are we like sitting? It's like the most generic of generic stage 0 questions. You're going to start with QBank. You're going to start with my YouTube MCQs and my PDFs. Pure Aura, which NBME, but you're just going to start with QBank. Like if you're early in prep, just do Q, start knocking out questions, get things wrong. It's fine. Just, you got to go through QBank. Pure Aura, what NBME should we use for step 2 CK? 6 through 14. So you're going to finish QBank and then you're going to do all of the clinical mastery series forms, 50 forms, 45, 50 forms, 2 per day. It's 3 to 3.5 weeks. NBME 6 through 8. Double pass of all the CMS forms, free 120, 9 through 14. Manos Weenie, thanks again for becoming a member. Crypto trading with Will. Good to see you back. Is there an optimal amount of time we should spend per PDF that is 50 pages total equals 2 hours? That's laughable. That just shows you're out of touch with how like most people are. And that's fine. You're fast, man. Guys, how laughable is that? Imagine going through one of my PDFs, 50 pages in 2 hours. You're like, I can do that. That's easy, Michael. No, it's not. Give me a fucking break here. I have people who it takes them a week to maybe get through one PDF if they're lucky. It's like if you can get through like 10 to 15 pages a day of like one of my PDFs, like that's pretty good. I'd say it's like good. I've come 98. I'm still hesitant on taking the CBSE, but finding it on YouTube is probably like 50% of my motivation to take it. Ziri, hello. I would do UWorld once and read your PDF and no NBME done, then gap for 5 months. I want to restart again. Can you help me to make a plan? Well, I make custom plans for people over Skype. That's what I do. That's expensive though. You'd have to not be able to pay rent. Just spend a month on the street, but you get a plan and that will work itself out. Just study at the library or something, sleep in the library, but you got a plan. You didn't pay rent, but you got the plan you needed. But I do recommend doing UWorld once, correct, or Amboss. It doesn't matter. Do either QBank. You're going to read, I've said, you're going to do 40 questions in the morning on time tutor random, 4 blocks of 10. Take lunch. The afternoon, evening, it's going to be my PDF reading, YouTube MCQs. Okay. You can titrate from 40 up to 80 on some days, depending on if you have really good momentum with questions. You just want to keep knocking them out. You got to get through all of a QBank, and then you're going to do the NBMEs after. That's like basic starter stuff. Life, thank you for becoming a silver member. I really appreciate it. Hell yeah. Appreciate that. Yash Ranga. Yash, I'm trying to remember where I saw you. Maybe you DM'd me or something and I ignored you. I'm trying to remember where like your name looks familiar. Usama Malik. Hi, NVME's 2025, 52, 58, 64%. All fails. 64 borderline. 25, 58's fail. 2 months back. Okay. Done by UWorlds, 58% average. Exam September 7th. Okay, you have time. How to proceed. If your exam's the 7th, I want you redoing all the NBMEs as though you've never done them, starting from NBME. Well, you're gonna redo the ones you've already done, but this process is gonna start a month before your step. So in August 8th, ballpark. You're gonna do QBank and YouTube MCQs and PDFs until that time. But you're gonna go through all the NBMEs you've already done. You're not gonna worry about your scores because they'll be artificially high since you've already done them clearly. But then you're going to do free 120, then NBME 26. That's what I want. And I'd look at your scores at that point in time, see how you're doing, and determine whether I want to use the other NBMEs or whether you're going to have to postpone your exam and go back to QBank for longer. Guys, give the video a like, come on live stream. Subscribe to my channel if you haven't already. There's some of you in here who aren't subscribed, and I know that because I see my analytics. Paria, Remolina, I don't doubt the account will grow because the PDFs speak for themselves. It's just word of mouth. Yeah, I mean, I'd say I'm growing pretty slowly. Like there's people out there who put up like, 29 videos and they have like 90K subs. Like I'm growing very slowly. I have like 1,200 videos and like only 17 plus subs right now on YouTube. That's pretty slow, I think. But I noticed things are starting to accelerate. I mentioned, someone asked about this like the other day in the live stream, that like I said how when I started the channel in late 2020 and I was making videos, I was getting like 4 views and I was talking to myself. That's what it felt like. I was just making videos for myself. And I think I said in one of the clips that I was like, if I get 8 views on this, that would be like a big deal. I actually meant that. And like and then maybe this time, yeah, like the summer of 2021, I think I was getting maybe like 4 subs per day on average. I was pumping out videos. I was getting like maybe 4 new subs a day, like on average. This time last year, I think it was maybe like 20. I was getting like 20s subs per day. And like right now, it's like maybe 40s, 50 plus. It fluctuates. Sometimes it'll be like 69, holy shit. And then it's like 32 and then like 49. So I'd say in the 40s right now. Maybe next year it'll be 60s or 80s and then 150. I don't know. There's no entitlement, but it's the acceleration. I'm starting to notice it. Mustafa, hey, Dr. Mike, thank you for saving me literally dreading and hating every hour of question review by advising on reviewing every question immediately after answering it. Yeah, I mean, I said untimed tutor random is the ideal way to go through QBank. Let's see, lost where I was. Dream IQ 7, a lot 10 times for guiding us, Doc. Abcom 98. I'm not gonna like read that out loud. I don't need bad fucking energy. But yeah, if that were to happen, yeah, Rumble, that'd be hilarious. That's funny. It's funny, but like not funny. Dawit Lamecha. Any advice building consistency in studying while doing a full-time job? Well, if you're doing, you shouldn't have a full-time job while you're studying for Usmle, because Usmle is a full-time job. But you might say, well, I don't have that choice. I'm like 44 and I'm like got a family, whatever it is. Understood. So the advice is you just have to fucking make the time. If you've got a significant other, if like whatever your circumstances are, ideally that person will like understand what you're doing right now and kind of like take on some more, family work or whatever it is while you're studying. That's kind of how it works with a lot of people. That's what it is. But recognize that studying is supposed to be a full-time job. Let's see. How many times are you going to ask about like blood work, Mana Sweeney? Saw an OBGYN's CMS. I don't know what question that is. If like you can DM me, Mana Sweeney, if you're still in the live stream, DM me the question on Instagram. Make sure you're following me, because if you're not following me and you send a question, I won't read it and we'll delete the DM instantly. But just be like, hey, I'm Mana Sweeney. I was the one who got like a bronze member in your live stream, and here's the CMS OBGYN question about like blood typing or whatever, and like I'll look at it. Let's see. Maswer, Mike, for just one-time hookups, is approaching still a good route? And if yes, do you see it changing too, like dating has changed? I mean, I've said that, and I've discussed this many times before, how digitization, that is like all the online stuff, IG, dating apps, all that stuff, that's doing to IRL, in real life, people meeting, cold approach, guys walking up to girls. So digitization is siphoning the value out of real life cold approach, the same way Bitcoin is starting the process of siphoning out pecuniary value from gold. Okay. I think what this means is, I think in terms of relationship building, it's going to be very, very rare. I think by 2030, nobody's going to meet in real life anymore. Because like you have social circle, right? That's how a lot of people meet now. But like think about it. Like I think physical schooling and like offices, like that stuff's already going digital, like virtual, isn't it? So I think like by 2030, like it's going to be very like unusual for people to meet in real life. It's already like unusual. It's pretty like unusual. Like that's the culture we're in. Like if a guy walks up to a chick and says hi, that's like weird. Like people perceive that as like weird. You'll get people who are like, "Oh, I wish I got approached more." It's like, no, you don't, because they'll say that, and then some guy will go say hi to them and be like, "You're creepy," kind of thing. Um, that's the experience guys face for the most part. But to answer the question, I think that short part of consolidation is that I think relationship building, real life approach is going to be phased out. Essentially, you'll still get value from it. Gold will still have monetary store of wealth in 2040, just not what it has now, because Bitcoin's going to siphon it. So I think that, yeah, you can meet people and date, like build relationships through in real life interaction, absolutely, in time. But it's all getting siphoned to the digital environment, where a girl 15 years ago, if she didn't get approached by a dude on the street, she didn't fucking meet a dude. It was like, school dance, fucking in class, at the office. If she didn't get approached in real life, there was no fucking meeting a dude. So she wore her fucking emerald bracelets. She fucking got plastics. She used to actually wear makeup. Now girls will sit without makeup in their parents' basement using their little app and get like 50 matches, and then, have entitlement to some 11 out of 10 Tom Brady, multimillionaire CEO model type dude. Something negative. We're talking about like observations here, but it's like, I think that that's where relationships are going, just digital. And I think that, but you're asking about one-time hookups, which is going to be, I think you can capitalize on micro state, essentially, micro and acquiescent state. I don't think that'll change. I've been pretty firm that that's in the moment. It's a long discussion. I want to keep this focused on my medical feed, but in your case, correct. Even in years to come, you can walk up to 50 girls in the street and you say, let's go to cafe. No. Let's go to cafe. No. You want to go to cafe? No. You want to go to cafe? No. You want to go to cafe? Sure. You go to cafe. You want to watch a movie? No. Go back out on the street. You repeat the process. You want to go to a cafe? Sure. Go to cafe. You want to watch a movie? Sure. You just do that. And then, yes, that'll lead to hookups. Okay. I mean, that'll trigger some people. What the fuck do you want me to tell you? But that'll be situational. The girl will ghost, because then she'll, go back to her apps or whatever. She doesn't need you. She doesn't need you. The fact that she met you and hooked up, she doesn't need you, because she'll just go back to her apps or her digital domain. You know what I'm saying? But I don't think for approach for one-time hookups, that'll be the residual value. of cold approach in the future. It'll be you getting cardio, walking around for 2 hours approaching. That'll be value of it, just cardio, literally fucking walking around exercise. Plus, maybe you can get in the moment hookups that way. But in terms of relationship building, that value is getting siphoned out. As I said, the same way Bitcoin is already initiating the process of siphoning out the pecuniary value from gold. Paria Remolina, Jonas Adima. Hey, Mike, what's a good score percentage to pass step one without any doubt? 205, 210 plus equivalent on the NBMEs. I would say 70% plus I want to see on the NBMEs. That's solid. 70 plus is solid. High 60s, not bad, but I like seeing 70 plus. Crypto trading with Will, I just used 2 hours as an example. No chance anyone could move at that pace. Yeah, I mean, some people will be like, I'm really fast at reading. But I think 10 to 15 pages a day, like in my for my PDFs, is like good. Appcom 98. Don't you think it's disrespectful to Japan that you never watched anime? I said I used to watch JoJo anime when I first got here, but I wasn't like a wannabe about it. You say also, did you see that American fool Twitch streamer that made Hiroshima Nagasaki jokes on Train in Japan about a month ago? Well, you say fool, Twitch streamer. Well, apparently it got your fucking attention, right? So it can't be a fool in terms of internet, as far as the internet's concerned. I've said that most people, like most gaijin foreigners who come here, who watch like anime and stuff, they're like wannabes. I said that. Like I've lived in Japan 7 years, and I'm a permanent resident here. But I've said that. You kind of have to. You need to live here to understand the feeling of it. But when I tend to see like there's a class of gaijin foreigners that like they try to be fucking like read all the comic books, manga. They try to fucking like they're like I watch anime every day, and they all look the fucking same. They all wear like glasses. They're like anime fucking clothing, and have like blue or pink hair. They all look the fucking same. I can appreciate like a look, an appearance like that, but I know personality wise as a gaijin, like those are people who like want to be fucking Japanese. I was never like that. Let's see. Braden Jackson, how long does it take you to build a PDF? Depends. I mean, it really depends. Like they're highly variable depending on the topic. Pure aura, is it necessary for an IMG to go to USA for clerkship after step one? And what marks are needed in steps for general surgery residency? I mean, for general surgery residency, like ideally you're above pass for step two. Like I'd say 230 plus is good for surgery for step two. Under 230, IM, family medicine, obs-gyn, peds, psych. Obviously, if you have USA clinical experience, that can help. I don't see it as mandatory necessarily. Should you do your world random or by system? You're going to do random untimed tutor mode. But so 4 blocks of 10 random untimed tutor, if you feel that you need to remediate in a certain subject, e.g. immuno, so you're like, well, my immuno sucks jack fucking shit. If I'm doing QBank and untimed tutor random, how am I going to remediate certain subjects? The answer is after you finish your questions, untimed tutor random, the afternoon/evening phase of the day, that's when you're going to do immuno PDF, let's say, with immuno questions for my YouTube MCQ. So that will be like your subject specific. So you can have like a week where even though you're doing QBank in random mode, the afternoon, let's say, and evening, that you're like, well, I'm finished. It's taken me a week to knock out this immuno PDF, and I'm also binge watching all the immuno questions, finishing his immuno playlist over the course of the week, right? So that's how you can knock out the systems. I want you to know cardiopulm, renal, gastro, heme, hyoid arrows as priority. Let's see. I'm ready 18. I'm in residency, planning for step 3 at the end of September. Can I just focus on NVMe content, curtail UWorld? Well, UWorld's only 1,900 questions for step 3, so you can bust through that quickly. Nick. Hey, Mike, good to see you back, Nick. Hey, Mike, would you recommend doing a step program like Kaplan or Pass for step retake? You told me not to take step one. That made me scores around 60, and I took it anyway and I failed. I mean, those are just like, that kind of pawns off the responsibility. I don't think you need to do a program like that. I think you just have to do QBank. You need to just sit and do QBank. That's like really what it is. Like you gotta, if your scores are low, you really have to just sit in a fucking room and do QBank all fucking day and do my PDFs from YouTube MCQs. Like people are looking for some shortcut. No, like what do you think Kaplan or Pass are gonna do? You're gonna sit in a fucking room, watch their bullshit lectures or whatever it is. It's like, why don't you just do fucking questions? Like, why is that hard? So sit and do questions. Um, those courses are more for B2B. Those are like for, they make a killing off like the Caribbean schools that don't know how to fucking teach, where the students aren't passing comp. And the step one, you got a lot of, the curriculum or the admin will say you got to do this program, and it's not for the benefit of the student necessarily. It's just pawning off the responsibility. But you need to do questions all day. That's what I want you doing. Syed 20, you're amazing, super helpful. I wish I could repay you somehow, man. Okay, you can repay me if you want. Drop a super chat. You can drop a super chat if you want. You're like, no, I'm not going to drop a super chat. You don't have to. There's no entitlement. I know you're just saying that's sort of like not actually literally about money. You mean just like in life. I get it. I'm just kidding around with you. Abcom98. Twitter monetization just started this week. I feel like you might do really well on Twitter. I don't know if you have one already. I don't have Twitter. Twitter monetization. I don't know. Like, how many of you guys actually use Twitter? Like, do you guys actually use Twitter? I'd have to like make a new account because like I don't use Twitter. And I think Threads, the fact that it connects to Instagram, like it's pretty good in that realm. Even though like it's like Threads, the traction's very small on it, on my account at least. I said I posted matcha and I got like 3 likes. But I mean, do you guys actually like use Twitter? Anonymous T. I had my psych shelf yesterday. The length of the question was frustrating. My score also reflects that. I did all the CMS in your PDF, but I had a hard time finishing the exam. I'm frustrated. What's your advice? What's my advice about what? You finished the psych shelf already. So what do you want me to tell you? It's done. I mean, for each shelf, you're going to do like QBank. You're going to do my PDF in that subject. You're going to do my playlist from YouTube in that subject. And you do all the CMS forms twice. You said you had a hard time finishing the exam. I mean, if you did the CMS forms twice, you did my PDF, did the YouTube or the UWorld questions, Amboss questions, you're fine. Sacred Scout, how would you deal with one? A friend that said he must be more attractive than you because same chick wrote more. 2, a friend who said that you seemed, in quotes, you seem to think you're attractive. Not going to comment on that. So I'll answer your first question. How would you deal with, you said 1, a friend that said he must be more attractive than you because same chick wrote more. Yeah, I think you were saying how like, I don't know, you and someone else approached the same girl or something. I wouldn't really read into it, nor would I give a fuck. Like, that's the thing. People respond differently. I wouldn't give a fuck. I would just be like, my response is like, you just need to meet other people in. I wouldn't worry like about, it seems like an insignificant, trivial thing about like who wrote more, who fucking cares. I don't really think about that. I'll tell you how to solve it. You just say to her, hey, you like coffee? She's like, not really. And then you're like, okay, why don't we meet up, get like a tea or something? She's like, no, I'm good. And you're like, all right, that's the end of it. Like how about that? How about rather than trying to speculate based on length of fucking text that you're receiving, why don't you just, money where the mouth is? And it's like, just fucking see if she comes out. No. Okay. Peace. And then you just like, that's it. You delete. A friend who said, and then you said a friend who said, I don't know. That sounds like ESL, English second language. I don't know what you're asking with that second question there. Ayad Ali, hey Mike, why NBME would give 95% plus passing chance if you pass 197 to 200 borderline. Does it mean NBME's underpredict? I mean, it's more that I like to see more of a buffer because I know the NBMEs don't lie. So I don't want students going in just barely passing. I don't want that. I like to see 205, 210 plus. The 95%, I don't know where they get that from. I don't really feel it out that way. I don't really feel it out that way. I think they go up based off that one form, and then they probably get that calculation from like they take one form and they say 95% or some confidence interval. They say you got a 199 equivalent, and there's going to be a confidence interval like plus or minus like 6, but still it would be like mostly chance of pass. They're just going off like one form confidence interval. I don't really. I just want to see 205, 210 plus. Abcom 98. Before you cut me off yesterday, I asked about medically assisted suicide. Canada seems to be fully on board. What are your thoughts on it? Should student doctors be involved, exposed to it? I don't really have views on that. Medically assisted suicide. I'd say that's like that's like a slippery slope. I think that sort of thing. I don't know. I don't really have like an informed, deep view on that. I just think any type of like assisted suicide is like that's a slippery slope. That's not. I would not necessarily advocate for that. Sacred Scout. Do you also think, Doc, that it is possible that a chick will ghost you? Do you also think it is possible that a chick will ghost you because you did not recognize her and or confuse her with another girl? Question mark. I accidentally reapproached and lost her after a great date. I don't think it fucking matters. I actually don't think it matters because it could go either way. Like it really could go either way. I think maybe it's just that happened to you, but it wouldn't have gone anywhere anyway. And the reason I say that is because I mean I don't want to be like anecdotal about it, but that's like happened to me a lot actually, where I like I mean I've approached like the same people like in the city and stuff, and like I don't think it fucking matters. I mean, how anecdotal? How many anecdotes do I have to give here? Do I need to go into that? Do we need to make it story time? Do we? But I mean, there have been times, okay, where I've approached and then it's a rejection, or it's and then I double approach and then it's a follow through. I mean, there's things that happen like that. I think that's mainly just state. That's female state. You have to recognize that like the chick's going to ghost the vast majority of the time anyway. So that could have just been the trajectory it was going to take. I don't think she can pretend like she was offended you didn't recognize her. She doesn't fucking care. She doesn't fucking care. It's like the same way that like if you bumped into her in the street and she's like, "Wait, who are you again?" And you're like, "Oh," and are you so offended that like you weren't going to meet up with her again? You're like, "Well, I didn't. That's not ideal, but I didn't. I'm not going to like not see her because of that." So she was just going to ghost anyway, and then that can be used now as like a pretext, a convenient pretext for a ghosting. Offbeat medicine. Did you say NVME's 2031 top priority? Question mark. Do you look at UW Boss? It's top priority too. No, they're not top priority. Which one is greater than the other? No, I've said they're non-superior to each other. UWorld and Boss, non-superior. You can choose one. UWorld greater than NBME? Question mark. Absolutely not. NBME is priority. That's why you're ending on NBME's 20 through 31 for 120. Offbeat medicine. Secondly, you say do NBME just for the sake of us getting repeats on actual exam? Question mark. It's not just that. It's like the NBME questions are the real Usmle, so you should be doing those questions. Like there are repeats, yes, but even if you don't get exact repeats, the concepts repeat. So in order for you to have gut instincts, augmented sense of gut instincts on the real deal, if you memorize all the NBME questions, then even if you get novel questions you haven't seen before, you can lateralize and extrapolate and be like, well, I remember seeing a similar question on EG NBME 27, and this was the answer, so I'm just going to go with that on this one. So it'll help with your gut instincts on new questions as well. It's not just about getting like 9 repeats. Okay. Div, you don't use Twitter. Twitter Blue ruined it. Well, I haven't used Twitter in years. Let's see. But I think like verification, I think that's going to go both ways. It's kind of like, I don't know. I didn't use Twitter. Syed Med 20. I would actually drop in the super. I would drop in the super chat if I match. Haha. What's your? That's like you'll drop in the super chat if you match. Mike, I'll give you $2 in your super chat if I match in the distant future. Like, please. What's your advice on the importance of UWSA one? But now I'm going to ask my question and take your time for you to answer it for free. What's your advice on the importance of UWSA 1 and 2? I have the NBMEs lined up, and it's hard finding time for UWSAs. I've said that I don't prescribe UWSAs basically always for students. I don't mention them. Like UWSAs can have a time and place if you've already, let's say, exhausted all the NBMEs for a comping to get through school comp. You don't have any more forms. We go to 19, 18 NBMEs offline, or a UWSA could be utilized. I don't routinely recommend them anymore. Another confusion, people who have recently given the steps say that the exam is more like UWorld UWSA nonsense. I already addressed this in the chat today. Less like the NBMEs. Hearing that was really stressful. Your thoughts, question mark. I just fucking said that. It's escapism. The real Usmle is the NBME question. It's just going to look like a UWorld interface. It's going to be a UWorld appearing interface when you go in there, okay? Same calculator, colors, lab values. It's going to look like UWorld, okay? But the questions are the NBME ones superimposed into that interface. So it'll be like doing an NBME 32, 33 and a half. Matthew Muniz, related to NBMEs underpredicting. If it were required to get a certain score on CBSE, should we assume NBMEs underpredicting that score as well? They don't underpredict. The scores are accurate. Sacred Scout, I was feeling really sick and weak today, so I took 150 milligrams of venlafaxine after 3+ months of abstinence again, and I feel absolutely terrible. What can I do to ease the discomfort, flush it out faster? Time. You should just get away from meds. I would just throw away all your medications. That's what I would do. In your case, you just need to throw out all your fucking meds. You got like a polypharmacy issue. You gotta just throw out all your fucking medications and then deal with feeling like shit because you're on like withdrawal or something. Sometimes you reach like a trigger point, like an inflection point where you just have to like cease everything you're doing. That's like how I will be with caffeine sometimes. Like I drink like more and more and more until I just have like I feel like shit because I'm drinking so much caffeine it doesn't help me, or I just feel tired or something. And then you have like a correction where you're just like, I'm just gonna not drink anything, feel like shit for 2 days and sleep. And then you like wake up and you're like better again. And like one caffeinated, one coffee, all of a sudden you're like, wow, I feel it. Holy shit. Right. So I would just throw out all your medications, allow your chemical balance to just equilibrate back to a healthier state, and I'd kind of just go from there. And I'd go to the gym. That'll help you psychologically. I mean, I know you've been doing that, so just keep going to the gym. MJ, how to go through your YouTube videos, sir? Question mark. Playlist wise, or should I start from your first video? You can just go through playlist, and I'd also you could just watch the daily clip as well. Guys, give me a like, comment, and live stream. Subscribe to the channel if you haven't already. Maz, or any chance in real life dating will be saved if there's a major cultural shift to the right, or tech will still override a right leaning culture? I think it's only going to continue in favor of digitization and people meeting online. I think it's not going to get easier at any point. I think digitization is only going to continue to favor females in dating. I think in real life, cold approach will continue to be ruled out, as I've already said numerous times, like what Bitcoin is doing to gold. That's not going to be reversed. We're not going back to fucking gold. Okay, like Bitcoin's going to take gold. So I think that's what's happening with digitization over IRL in real life approach. But you ask about a cultural shift to the right. I think the only way to really, we could get into topics as far as eliminate, and I've talked about this stuff before, like eliminating abortion and Plan B, which would cause riots in the streets and stuff, you know. But I think that's the way to save the populations is to make illegal abortion and Plan B, which, as I just fucking said, that will cause riots in the streets. People will like change countries. People will import fucking Plan B from India or something. You know, that's like the type of stuff that'll happen. But we're talking like how to save populations from declining. You know, because you get women who'd rather sit at home on their little app and like wait. They're like, no, I don't want this decent dude who's like come across me in real life. I'd rather sit on my little app and wait for an 11 out of 10 Tom Brady to come along. And if he doesn't come along, I'm okay with zero. Yep, I'm okay with zero. That's how like women are. Most women are. It's nothing negative. This isn't like it's not derogatory. I'm not even. It's not even personal. It's just I know lots of guys, who guy friends who attractive young guys, like no homo, and they struggle to fucking meet decent chicks because every fucking chick ghosts them because the chick, rather than being open to a dude who meets her in real life, she's going to sit on her little app. You know what I'm saying? It's just digitization in general. But I don't think that that's going to get any better for dudes. I think that in real life, cold approach is being siphoned out. And I think that it would really, I think any correction or inflection point in the future is going to come down to a population saying, we're in serious trouble now. We're in serious trouble in terms of population numbers. And we're going to have to make illegal abortion and Plan B. And then you'll get riots in the streets, as I said. People changing countries, right? I mean, people burning flags or whatever because they want to kill their babies. They're like, I'm going to burn this flag and riot because I want the right to kill my baby. That's how, people will be. And then, but I think that will save populations eventually. Abcom 98, hear me out. Maybe AI will take care of it. Maybe AI will just like sort that out. AI will be like, no, it's good that the humans are killing themselves because they need to have declining numbers. Like maybe AI will like facilitate that. They'll say this is a trajectory where it looks like we didn't kill off the humans. AI could work that out. AI is going to be infinitely smarter than humans, AGI. So like they could just make humans believe that like humans, they themselves don't want kids, and AI will calculate that. They'll be like, yeah, humans are done, and they'll think they're the reason, that we're not the reason. They can perpetuate, content on the internet and just keep humans within their own little bubble and be like, yeah, we're not responsible. Humans think that they were doing it. AI will facilitate decline of humans probably. AI is not going to need humans. Humans are too stupid. Like, what's the benefit of having like when AI comes along, right? But I'm saying in general, to save populations, you got to get rid of abortion and Plan B. Let's see. Well, Abcom 98, I do have another channel, but I just don't use it. I just talk here. I don't need another channel right now. Mohammed. Okay. Just reading some comments. How do I structure the next week? I have 13, 14 NBMEs left. I don't know. How far are you from your exam? That's what I want to know. How far are you? When's your exam, Nishad? PRR, USA versus UK for surgery. Which one would you choose? I would never choose fucking surgery, so neither. And I wouldn't want to live. I would choose the UK. Why would I want to live in the US surrounded by guns? It sounds like the worst fucking thing imaginable. Let me do surgery, most boring fucking like field, and then let me live in the USA where everyone's like fucking clothes carrying a gun. That sounds like a great fucking plan. I don't know who that person is, Appcom 98. Foz came here just to drop a like. Thanks for all your work, Dr. Mike. Sacred Scout, I had not taken them for months, but I will do that regardless. Thanks, Doc. I think polypharmacy is a bad fucking idea. It's just throw out all your medications, bro. Seriously. It's not hard. Just throw out it's mental strength. Throw out all your fucking pills and whatever you got. Just don't you know, translate it over to something else, or hops, like as I said before, hopscotch. Don't just hop loci. Don't like when you throw out your pills, now you're gonna fucking start drinking stuff now. Like, don't do that. Just like throw out all that polypharmacy stuff. Omar, if I have solid foundation, can I do more than 80-year-old questions per day? No, I don't want you doing more than 80-year-old questions per day. Once you hit 80, you're done. You're just going to do other content. Maximum 80-year-old questions per day. Minimum 40, maximum 80. Thank you for answering questions. Hey, Adelie. Hey, Mike. Do you think there has been score inflation step 2 recently? Many people are scoring 260, 270 plus more than ever. Absolutely, there's score inflation. I say I only got a 260 on like step 2, which was a decade ago. And like people are like, only? What do you mean? That's like a good score. 260 would be like 260 back when I sat step 2 would be like getting a 270 today. And it sounds like it's a stupid talking point, but it's like score inflation is a real fucking thing. Like I never would have imagined that when I got my 260 back on step 2 a decade ago, that today that would be like an okay score at best, from like a tutoring angle at least. Like it was like a good, imagine getting a 270 on step 2 where you're like really happy about that. And then like 10 years from now, that's like considered like decent, not like great. Muhammad, too much text. I don't know. I can't like, I'm going to end this live stream pretty soon. I have 1 month to my exam and I'm done with UWorld incorrects. Should I try to cram all 50 CMS forms? Emojis 9 through 13. It's like too hectic. Your like question is too hectic. There's like too much stress in there. I don't like that. Can you like ask that like less fucking packed with stress? If you have 1 month left till your exam, you should only be doing CMS forms and NBMEs at this point. Sacred Scout, when you agree that moving to a country in which the women are still valuing having families and kids, which fucking country would that be, bro? Would be the best move? Question mark. Where? Tell me. Where? Africa? Is that where you're gonna go? Any place that's modern right now, women don't want families. Women don't want kids. Women want career, and they want to maybe have a kid when they're in like their fucking 30s or something. Basically, the more right wing a country is, better to approach? Question mark. I would just basically research which countries actually have like a higher birth rate that's like, and then choose a country that's like safe enough for you to go to. Right? Don't go to like, you know, a country where chance of death from like a military infiltration or something is going to occur in like the first 3 years you're there. You know, like a military, a paramilitary unit like storming your village in like the first like 6 months you're there. Like you don't want that. But like, you know, I wouldn't move to a country that has a low birth rate, because what that means is you've got a push of like feminism where women don't want kids, they want career. There's nothing wrong with that. I have to articulate that. There's no judgment. People can do whatever they want to do. People get real fucking triggered in 2023. You know, the notion of like saying like a woman should, you know, pursue family over a career is like misogynist. I'm not saying what people should do. I'm just saying like there's a reason why we've got population decline. It's because rather than having kids at 19 to 22 like women used to, now it's like let's pursue a career and have maybe a kid when we're 39, or like not have any kids. You get a lot of women who don't want kids nowadays. I think that's a problem. But I mean, once again, I articulate that there's no judgment. People can do what they want to do. It's not fucking rocket science, though. Okay, in terms of why we have population decline, it's like too much abortion, too much Plan B. I mean, that's what it is. It's not fucking brain science. Let's see. Nishad, like I said, I have NVMe 13, 14 left. Yeah, but I asked when your exam was. Jonathan Rocha, if we were able to control our autonomic nervous system, how many diseases would be eliminated? Sunny, how do you prevent joint pain and tendonitis from heavy lifting? It just happens. You can wait. You can try to wait it out. You say I have pretty good form with my joints. That's like happened with my triceps tendons like recently. I've had to give like, I'm doing like compound exercise, obviously, like bench, shoulder press, but I was doing like a lot of like different like tricep extensions, like skull crushers, like lots of tricep exercises up until maybe like 4 or 5 days, maybe like 4 or 5 days ago. But I just had like, I get soreness in my tendons right now. Even when I do like bench and stuff, you kind of have to wait it out, unfortunately. You can push through it, But you gotta, like, if you're actually having sore tendons, very fucking annoyingly, sometimes you gotta like deload, have some days where you do like different movements, and then come back to it. Remember that your tendons have to grow the same way your muscles do. You know what I'm saying? Like you can get micro fracture, not fractures, but micro tears in the, the collagen and stuff because tendons aren't used to taking on that load sometimes in people. Or if you're running, your tendons and your ankles can hurt you the same way. So your tendons have to heal sometimes. Let's see. I don't know who that is. Outcome 98. Sacred Scout. Yes, I will take. I will just take psychedelics to facilitate emotional healing and growth. No more meds at all. Laughable. I know you're trolling, but you're like, no, I'm not trolling. No, I know you're trolling. Jonathan Roach, I'm 33. Should I still try the Usmle or am I too old? You're not too old. I have like students who are like in their 50s. I've had students. I said this in prior live streams. Like I've taught students on Skype who are like 58, like parents, like my parents, which can be weird because like I don't change my behavior for anyone. So like I'll like a student who's like 58, and I'm like, I send them a question or something, and they're like, "Hey," I'm like, "It's fucking wrong." I'm like, "You're fucking wrong," and then I'm like, "Try again," and like so that can be like a little unusual. Um, I'm just like this like punk kid, and then I'm just like, "You're fucking wrong," and they're like, "Okay, I'm fucking wrong," and then that's just how it progresses, right? Let's see. But I mean, I get students who are like 50 sometimes. Devansh Gupta, I heard about step 2 inflation of scores, but do they consistently also scale step 1? Question mark. I know it's pass or fail, but not wanting to know if the scores are scaled. Step 2, I've said yes. Score inflation is real with step 2, for sure. People are getting higher scores now than they used to. Secret Scout. So birth rate of a country in parentheses with low crime rates is a solid indicator. Thanks, Doc. Uh, yeah, I mean, it makes sense, right? Like the lower the birth rate in a country, that coincides with greater female focus on career. This isn't fucking rocket science, okay? If like if people have families, if women have families when they're like 19 to 22, like they used to back when our grandparents had kids, then families would actually grow. And now it's just the culture is get multiple abortions and take plan B like it's candy, well, until you're like 38, and then like maybe have one kid with reduced fertility. It's like laughable. But you did your career. I mean, like, you had a career. Like, so what? Men don't find career attractive in women. They don't. What men find attractive in women is a desire to have kids. That's like a big secret, believe it or not. And then look, there's no judgment. People can do what they want to do. There's no judgment, right? People can do what they want to do. Um, but no guy is like if I meet some chick and she's like, I have a PhD in photosynthesis, that's like a turn off to me. Like I don't like that. I'd rather like meet a chick who works at a convenience store. That sounds like a parody, but like it's not a joke. Like I'd rather date a chick who works at a convenience store. Like I would have no interest in some chick who has like a PhD because I just see education. I see those like I see that type of focus as related to inversely correlated with maternal proclivity. Focus on advanced education. I'm not saying once again what people should do. It's just people are going to have different views, but it's not fucking rocket science as to why populations have declined. It's not rocket science. If we were to sit in a conference room and discuss and just say we're just having a discussion, that's it. We're just having an innocuous discussion as far as why were populations growing more back in the good old days, back in our grandparents' days. Why were populations growing like more? Less abortion, less Plan B. Women had kids when they were 19, 22, and not focusing on careers much. I mean, it's just those are the differences. No opinions. We're just voicing what could have been different, and not brain surgery. Let's see. AI doc, yellow fever, dengue, Zika, West Nile exist in Usmle. Yeah. West Nile virus is on NBME 11, I believe it is no, NBME 12. I think it's NBME 12. There's a question of West Nile virus for step 1. They say a painful headache, which sounds like dengue, but then they tell you that there's a bird reservoir, and the answer was West Nile virus. It's spread by Culex mosquito. They said what is spread by Culex mosquito and has a bird reservoir, and the answer was West Nile virus. It's like NBME 12, step 1, offline. Nishad M. And this isn't like AI shit. It's because I took that form online back in the day, so I remember. I got 8 wrong on that form when I took it out of 200, and that was one of the 8 that I got wrong. And I was like, "How is this not dengue?" Because there's a painful headache. But that was how that's why I remember that question. Let's see. In the shot, I think there was an issue with my comment posting. I have 1 week left. Did NBMEs 10, 11, 12, UWSA2, scored 247 on 10, dropped 3 points, still have 13. You like write too much. He scored 247. I mean, like, dude, your scores are fine. You still have 13, 14. You have 1 week left. I mean, is this rocket science? You have 1 week left. You haven't done NBMEs 13, 14 left yet. So you're going to do each of those forms. Give yourself 2 days per form, and then just like review other NBME questions. Esther, how can I improve my general principle sections? Maybe it's pathophys. We talk about this a lot. It's just knowing every disease and knowing the high yield points about them, the mechanisms. Okay. I mean, any disease you can think of, just know how it works, be able to answer any question about disease. Okay. That's what it is. It's pathophys. So hereditary steatosis, you got to know like the inheritance pattern. You got to know the gene that's mutated. You got to know like how it's diagnosed. You got to know like these principles. Okay. So pathophys, just any disease, CF, Duchenne. Okay. Just any disease. You got to know how it works, be able to answer questions on it. Devansh Gupta, LCR PDF's absolutely gold. I have my exam in a month. It's been helping a lot. Thanks, Dr. Mike. Bruce Wayne, should the last month be only NBMEs, or can I do some PDFs and audio QAnc? The last month should be NBMEs pretty much. But if you already spend like a significant amount of time on a given day on PDFs, then yes, do the spend a lot of time on a given day on the NBMEs. You can go to the PDFs/audio QAnc. Yusuf had step 1 yesterday. Thanks for the test day advice and all. All I have to say is your video on CML was golden for exam. I have many questions on CML, but yeah, you're right. I mean, I focus on high yield stuff. Sacred Scout, as of recently. I'm feeling massive chronic pain and soreness all over my body. Sounds like fibromyalgia, psychosomatic, because you're you're an emotional fucking dude. I would say that's fibromyalgia. Like I linger around in bed for hours because of the pain. Yeah, it's fibromyalgia. Even the stairs fatigue me extremely. How to get rid of pain? It's fibromyalgia. I mean, I'm not going to tell you to take an SSRI because you need to get you off the medications. Yeah, bro. I mean, I don't really know what to tell you. I don't want you on medications right now. I think you just gotta fucking handle it. You gotta just know that it's psych. You don't have any physical condition wrong with you. So I think as long as if you take awareness, if you take ownership of the fact that like it's just psych, I think you can like handle it better. You can be like, this isn't like real pain. This is just like psychosomatic fibromyalgia. Sonny, good thing about having a career, the good thing about have a career woman is it lowers the financial stress. No, it doesn't. Although that's also a beta move. No, I just think that the notion of financial stress is like, how pampered do you need to be? Do you need a fucking house that has 9 rooms you don't use? Do you need your fucking like car with a certain logo on it? Or can you like get by having less? So the thing is, the notion of financial stress, people should just be having kids. That's what the focus should be. People need to learn to get by with less. That's what it is. It's entitlement. People have entitlement to being pampered. People need their fucking like their brands. People need certain fucking like clothes, and they need their fucking car. They need their fucking like house that's too big. They need their stuff. Okay, and then that's gonna impede, and as a result, they're not gonna have families because they need. Um, I think what it should be is the dude just takes care of the cash, and then the chick just has the kids. I think that's what it should be. I see that as preferred. I see like uh, that's. I mean, guys. As I said, guys don't. I can't speak on behalf of all guys, of course, because everyone will be different. But guys don't tend to find career attractive in females. It's like, as I've already said, just it's a desire to have kids. That's what makes a female attractive. Because that's like, I mean, maternal characteristics. Like, wouldn't those be attractive? Um, let's see. Yeah, I mean, I see career focus in women. I see it as unattractive. That's my view. I'm not, so there's no judgment. People can do what they want to do. People are going to have different views, right? Let's see. Div, what is the reason for? Let me see. What if the reason for not marrying? You're asking what if the reason for not marrying is not career, but not finding the right guy and be stuck in marriage for the rest of your life? I don't really. I'm not a fucking chick. Okay, so I haven't like sat debating like these exigent, like urgent. I'm not in my like. I'm 36 as a dude, but women should be having kids when they're in their 20s, is my view. Like if a female's not doing that, I feel like that's late. It's like if I feel like I mean women I think should have kids like early 20s. So the idea of the right guy, quote unquote, that's modern. That's like there used to be like fucking arranged marriages and stuff. I'm not saying we should go back to that necessarily, but it's like this notion of like finding the right person is like what are you chasing exactly? Because would you rather just like not have kids is the question, you know? There's nothing wrong with that. Some people don't want kids. There's no judgment. I reiterate that. But I mean, um, I just think that people should have families. And I think that like if a female is waiting for this like 11 out of 10 Tom Brady to come along, and the result is she's going to be in like her 30s and like still not have kids, I think like it's like, what are you waiting for? Like, why are you focusing on like surgery when you're like 36? And like, I mean, like, you know, female doesn't have to want kids, no problem. But I just think um, people should have more families. People should have more kids. Mahmood, can I do medical residency in Japan? You'd have to be deeply, deeply, deeply fluent in Japanese, and like you'd have to be like half and have like native. You'd have to have native level Japanese here because you'd have to understand the culture and cultural nuances as well, not just like being able to speak Japanese fluently, but understand the culture here, the proprieties. Div, I feel like I'm asking about everything else except for Usmle. Fine, it's good. I mean, I have to answer this. I don't have to answer the same dumb Usmle questions all the time, do I? Right? Like, how many questions do I have to answer about UWorld right now? Amen, Osman. If I have 2 months to sit for CK, did UWorld CMS forms? I have to go to the gym. That's what I have to do right now. Let me see. I'm gonna go to the gym right now because it's after 6 a.m. where I am. I need to go to the gym. I'm just looking at some last questions. Sacred Scott, I think I have it because of my massive emotional suppression I did all my life. I won't numb myself out anymore than I should. Your comment sounds very like effusive. Like why all the emotions? That's what I want to know. I said that like you gotta like not be emotional as a dude. That's like an important thing. You're like, well, I can't help it. I'm emotional as a dude. Um, you gotta. I think you gotta like that's a starting point. Is like recognizing that like you gotta just fucking like handle things and like not be labile. If those are your propensities to like be labile, you gotta like try to take more cortical ownership of that. Exhibit some inhibition. Abcom 98, you talk about having kids for a man that doesn't have kids. How the fuck do you know? Isn't that like laughable? That's like laughable. Like, how would you know? How do you know that I don't have like 20 kids? How do you know? Where are we making these assumptions? I just think it's funny that like people make assumptions like that you have no fucking idea, bro. You know, I'm not gonna give like concrete answers because like that'll trigger a lot of fucking people, right? I've got religious followers. I've got like people who, you know, there's no. I get negative judgment all the fucking time. But how do you fucking know what's going on in my personal life? You don't know jack fucking shit. As I said, I could have 17 kids or something. You have no fucking idea. Who the fuck are you? Let's see. Hey, the good thing about having a career woman is not to see each other 24/7. That reads pretty funny, but I know it's like if people have a certain degree of space that can facilitate relationship cohesion. I need to go to the gym though. Just looking at final comments here. What do you think about studying early morning versus late night? I personally like. I don't think it matters. Just find a routine that works for you. Guys, I got to end this live stream because I got to go to the gym. All right. So obviously well, maybe not, but I mean, likely I'll do another one tomorrow, right? I mean, I've been pretty consistent with these. Okay. So give the video a like and also subscribe to my channel if you haven't already. All right, guys. I'll see you guys later.